So ADZ0120, which is a dual-targeting BCMA CD19 CAR-T, has two unique aspects. Number one, it offers an advantage by targeting both the malignant plasma cells by BCMA and CD19, which is supposed to present in myeloma progenitors. CD19 is a validated target in multiple in B-cell malignancies, including lymphoma. In myeloma, relapsed multiple myeloma cells can express low level of CD19. At the same time, the progenitor cells can also present with CD19. So targeting both the myeloma cells by BCMA and CD19 offers an advantage that could contribute to longer durability of responses. In addition, CD19 is manufactured with the next generation rapid manufacturing process. The current manufacturing process, with the long vein-to-vein time, limited patient access, and reduced T-cell fitness, can be overcome by this next generation manufacturing, because next generation manufacturing process can offer an advantage of healthier, more naive T-cells. If you look at the current CAR-T manufacturing, about 30% of the final cell product of the approved CAR-T therapies have naive phenotype, both stem cell, memory, and central memory phenotype. In ADZ0120, with the rapid manufacturing, we are seeing 70% of these cells are stem cell and central memory T cells. That has been shown to be very powerful cells for anti-tumor activity. So with this strategy of rapid manufacturing and healthier T cells as well as dual targeting, we believe that this can overcome and can be very effective in most of the patients and also prevent the ongoing relapses that we are seeing in the current CAR-T.